A very good evening, everyone. I welcome you all to this live webinar today. In the times of corona crisis and the prevailing corona pandemic across the globe, we at Elets Technomedia have embarked on a rigorous campaign to promote uh, and exchange the best practices, success models, and the technology and the solutions to combat the corona crisis uh, by getting on board several experts and the policymakers from across the country and from across the globe. My name is Sudhir Gautam, and I'm the Senior Assistant Editor and Bureau Head with the Elets Technomedia Private Limited. And today, to discuss today's webinar would be focusing on the strategic and unique approach of the state Andhra Pradesh to combat this corona pandemic and also the challenges they are facing. We would also be touching upon uh, how they see it as an opportunity, what is their plan for the exit and the way forward from this crisis. And we would also be touching upon the various aspects related to the state of Andhra Pradesh. And I'm very glad to have a very special guest for this live webinar today. And he is a medical doctor turned bureaucrat. He's a 1985 batch Indian administrative officer, gold medalist uh, in the field of medicine, and he also has immense rich experience in the field of administration. Uh, I had the opportunity to work with him while he was the principal secretary with the medical health and family welfare, and also with the finance department. He had played a very significant role during the reorganization of the erstwhile Andhra Pradesh before it got divided into Andhra Pradesh and Telangana. Just to give a background, over prior to joining the state services back in Hyderabad, he was on foreign deputation for about 13 long years. He worked with the United Nations fund, and he was with UNOPS, the agriculture fund, worked in the Middle East, in Arab states, in Africa, and also in European states. And we are glad to have him today in this live webinar to answer many questions that is out there with the audience and also with our moderator. We welcome you all, sir. Dr. P.V. Ramesh. He's the Additional Chief Secretary to the Chief Minister, Government of Andhra Pradesh. Welcome, sir, to this live webinar.
Thank you. Thank you very much, Gautam. Very good evening to you and all the participants. And I want to thank you, Ravi and Elets, for inviting me. And it's a great initiative that you've taken to really get all people together, share ideas, and particularly at a time like this, and when we are confronting one of the biggest crises ever. And thank you also for your gracious introduction.
Thank you, sir. And to moderate this session, we have yet another prominent person who, out of his sheer passion and drive to promote the technology and innovation across all the sectors in India, he has established this organization, Elets Technomedia, 17 years back. And he also introduced a very sector-focused magazines, including eGov magazine, which focuses on innovations in technology, e-governance. Also, eHealth magazine, which focuses on health systems, healthcare. Also, the innovations, and digital learning magazine, which focuses on education, and also BFSI, which focuses on banking, finance, and insurance. And Elets Technomedia is a B2B research-based organization that closely works with the government at the village level, city level, at the state level, at the central level, and it also worked with various governments in Middle East like Bahrain, Dubai, and also in Europe like United Kingdom, and also in United States and various other Asian countries. So join me in welcoming Dr. Ravi Gupta, who is the founder, CEO, and editor-in-chief with Elets Technomedia. Welcome, Dr. Ravi.
Thank you, Sudhir. Thanks for giving this detailed introduction. And I welcome Dr. P.V. Ramesh. Uh, you have had an amazing career in the IAS, very, very varied profile you have handled. And you have also handled 13 years of overseas assignments. That's a uh, 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 very diverse journey in your career. So I think for the interest of our audience, before we get into the technical discussions on the COVID situation and other issues, I will request for the benefit of our audience that if you could talk about your education and what made you join the IAS services and how has been the journey, the major unique positions you have handled and unique responsibilities you have executed in your career, if you can talk about it.
No, thank you very much, Dr. Gupta, for inviting me and for having me today. And then thanks to each and every one. And really, thank you for asking me this question because, many a time I am at a loss to explain what I am. And, am I a civil servant? I'm a technical expert or, what am I? And, I studied medicine from one of the best medical institutions in this country, from CMC Vellore. I'm grateful to that institution because it had given me a curious combination of what it means to seek excellence in science and in life. And number two is how much the public health and which are other than the socio-economic dynamics and the non-medical part of it influences the health outcomes. In fact, that is what has led me to the IAS and my recognition that perhaps I was the topper in my class. So, that was, I could have gone anywhere. And at that time I chose that I should really do something bigger in life and serve the people. And so that's how I chose to join the civil service. I was fortunate to join. And then my initial 10 years of service was mostly in the tribal areas and the Naxal areas of Andhra Pradesh. Between 85 and 96, I really worked in some of the most remote, interior, difficult Maoist insurgency areas. And that is where I learned the art and science of development practice. And that is what led me to the International Fund for Agriculture Development, in which I was a country program director managing projects across Asia Pacific for 5 years. And then later with the United Nations Office for Project Services for 5 years, based in New York, but covering various development projects in the Middle East and Africa. And later I was for 1.5 years with the World Bank in Afghanistan as senior advisor to the finance minister, setting up the customs department there. Then later I was with the UN Population Fund. So, as a 1 year as a country director and then 1 year as a senior advisor on programming in the security compromised regions of the world. Later, I returned back to Government of Andhra Pradesh in 2009. I was Principal Health Secretary for 3 years and then Principal Finance Secretary for 5 years, and during which I was also responsible for the reorganization of the state. Later, I went to the central government as Chairman and Managing Director of REC Limited, during which my tenure, I was fortunate to have a role in electrifying the country. Households and also villages. Later, I returned back to the state. I'm with the Chief Minister now as Additional Chief Secretary. I help the Chief Minister with human development issues. I coordinate also the COVID-related issues. So I'm grateful for all the opportunities that government has given, people have given, and my parents had given, my family had supported me. So thank you.
Amazing journey from tribal area of Andhra Pradesh to handling a lot of bigger portfolios in government of Andhra Pradesh and government of India and also outside India in United Nations. Amazing. tell us, please, in this situation when you are handling you are attached with the CM's office, you are the additional chief secretary there, and looking at human development issues which are health and education and nutrition related issues. How does this COVID-19 has, I think, challenged all ecosystems, global ecosystem, Indian ecosystem, state ecosystems. So how as a state, AP is working on to fighting this situation? What are the major steps being taken? If you can explain about.
Thank you very much for asking me this question. I mean, 4 months ago, none of us have heard of something called COVID or coronavirus. I mean, this was something really we started hearing in the first week of January, and then Wuhan was so distant. So it really didn't cross our consciousness seriously. And later, when it started affecting countries in the Southeast Asia, East Asia, and subsequently when it moved to Europe, the first case appeared on 31st of January in Kerala. And that was the time when we knew that this infection was spreading beyond China across the globe. And also the consciousness that this could come home. It has come home already by 31st January. So we started taking a closer look at that, and then to really talk to experts, to consult them, to read, to take a review of how well we are prepared of the situation. And the first awareness was that this infection has to come from outside. It was exogenous, not endogenous. Somebody had to physically bring that infection. And so it is international traveler who would bring it. So we were the first state as early as mid-February, soon after World Health Organization declared COVID-19 as global pandemic, and much before Government of India stepped in and recognized it as a national disaster, we started screening all the international returnees. We have only one international airport in Vizag. We started screening all of them and then started to quarantine them much before it became the norm, and monitoring them. We started to monitor. Then we realized that there were larger number of people who are actually coming from other parts of the country, I mean, through other airports of Chennai, Bangalore, Hyderabad, Delhi, Mumbai, and then they would fly in through domestic means or the other means. So our Chief Minister, he took charge in 30th of May last year, and his focus and his main agenda is really to strengthen the human resources. Human development investment is his primary priorities. His agenda is called Navaratnalu, which is 9 jewels, which is structured around essentially on health, education, nutrition, and decentralized, transparent governance, economic development, of course. So, and then creating a social safety net for vulnerable people. So that is broadly the 4 pillars of his development agenda. So the amount of importance that he has assigned to health and education is extremely paramount. I've not known any other leader in this country, at the state level or national level, who is so passionately committed to transforming them. So in the last 9 months, I'm saying all this is important because what happens is, I mean, generally in India, the public health system does not exist, or it is weak, it's debilitated. The other important thing is that when an emergency arises in the urban areas, there is no public health system other than the hospital system, because people mistake hospitals for healthcare. Hospitals provide the medical care. If I fall ill, they provide. They don't prevent the prevention, surveillance, health promotion, health education. These are not part of the normal functions of an urban administration in India, except in the metropolitan cities like Bombay or Delhi, Kolkata, Hyderabad. It doesn't exist in many other places. So we started actually strengthening these hospital system, public health system, recruiting nurses, doctors, much before. I mean, that was one of the mandates of the Chief Minister. Second one was really to provide hospitals with all the infrastructure equipment, to make them function, fill up the specialist posts, fill up the nurses posts. And then importantly, we've set up what is called village and ward secretariats. So every 2,000 households in the rural areas and 4,000 households in the urban areas have a secretariat with 10 technical functionaries, one among them being an auxiliary nurse midwife. In addition to that, every 50 households and in rural areas, 100 households in the urban areas have a volunteer. And this system I am explaining because it's unique to Andhra Pradesh. It is the Mr. Jaganmohan Reddy who conceived and implemented this in a short time. So every 50 households is a volunteer, so who delivers services to the household. So this is what basically means you have about 300,000 field level functionaries who could reach out to the people, every household. I mean, they have surveyed every household, they have mapped out everything about them is known. That is the reason why we have been more successful in terms of tracing out. So we have traced out all those who returned from overseas travel, and there were 29,000 of them. We traced 83,000 of their contacts, both primary and secondary contacts. And then so that is how we started: screening, identifying early symptoms, testing, tracking, and then treating. And then simultaneously, we strengthened the hospital system. We set up 339 quarantine centers. These are the COVID care centers, where you quarantine people who don't have symptoms, but who tested positive or have a contact with a positive person. Then the district hospitals, we have actually requisitioned about 23 of government hospitals and the rest of the private hospitals, together about 78 of them, with nearly 18,000 beds. And this is for mid-level, moderate to severe symptoms treatment. And then we have set up 5 state-level COVID centers. These are advanced care facilities. It's equipped with ventilators, with ICUs to provide care. So this is something which we have done in the last 1 month. So our strategy has been, number one, to trace every foreign returnee and his or her contacts, to identify the symptoms, test them, and then treat them. Similarly, when there was a lull between 24th of March, and in fact, we declared lockdown much before it became a national lockdown. We did that on 22nd. We declared it till 30th of March. And then, of course, it got extended and now extended to 3rd of May. So we started doing 2 things. One is when 30th, there was another flush of cases, which came from those who attended a Delhi meeting. Again, we tracked each one of them. We used high technology to track them. And so we essentially had about 1,164 who attended Delhi meet in Andhra Pradesh. And then they had about 5,300 and odd contacts. So we tracked each one of them, isolated them, tested them, quarantined them. And then, of course, we've been advocating public information, a lot of public information. Our Chief Minister monitors this on a day-to-day basis. There's a technical advisory committee headed by Dr. Srinath Reddy, who's also advising Government of India and Government of Punjab on these matters. And then we have a task force which is headed by the Chief Secretary. And so there are various, and there's a group of ministers committee which also supports the Chief Minister with all the functions. So basically, we have set up an institutional mechanism down to the PHC level and village level. And we have done 3 levels of surveys at the village and the urban areas. In the urban areas, we adopted a different strategy because urban areas is where actually you have concentration of the COVID cases. 80 to 90% of the cases are in the urban areas. So, and urban slum areas mostly. So we have now divided the town strategy into 3 sets. One is for those who have no house, homeless, beggars, those migrant workers. And then we put them in centers, we feed them, we house them, we take care of them. That is what we have been doing since 20th of March. And then the second set are those who live in the slums. There we have been making use of the self-help group women and the community organizers and community resource persons. So to trace everybody, so that earliest symptom, anybody having fever or cough or sore throat, the report flows in immediately. We've set up to to toll-free numbers 104 and 1902, which people can call anytime. Now we have also a setup for the telemedicine, so anybody who wanting can call in. So we are fairly very well organized in sense of able to trace and track each and every one of the 5.4 crore Telugu people, Andhra people. We've set up the testing capacity. We have now the highest in the country. Per day, we can now test up to 6, 7 to 8,000 antigen tests. These are not antibody tests. This is antigen tests. And we propose to ramp it up to 15,000 in the coming days. And this is important because when we started on 20th of March, we didn't have a single facility in our state. We had to send samples to initially to Pune and later to Hyderabad. And from there to now a capacity of 6,000, 7,000 a day, I think is an impressive performance. So this has come through really with a phenomenal amount of dedication from everyone. I mean, I cannot single out a single person, from collectors, from revenue functionaries. Every single person across the country, across the state has contributed to this. And citizens have cooperated. I mean, they themselves, in terms of staying home, quarantining, self-quarantining, practicing hygiene. So it has been a great learning in the last 1 month or so.
Amazing. This is amazing. It's a large state which we are talking about. So many districts, so many cities, and so many panchayats. So what is and the issue is that people can enter the state from various routes. Like as you mentioned in the earlier that domestic travel was happening before the lockdown happened. So many people, as you mentioned, that thousands of people would have entered already. And so perhaps many would have tried to enter through jungles or the smaller roads inside, like after the issue of migrant labor happened after the lockdown. So very complex law and order issues and very complex human issues also have emerged. How you have handled the human aspect of all this?
No, I mean, I think that's a good question. I mean, let me also say this. I mean, prior to the lockdown, of course, people were moving freely because, I mean, we have a right to travel anywhere in this country. This is our country, after all. However, after the lockdown, there has been a complete freeze on movement either between the states or between the districts. In fact, we had limited movement also between urban and rural areas. I mean, if you see, 90% of these people who are tested positive are in the urban areas and not in the rural areas. And the reason being also because the rural areas, people themselves are protecting themselves. So, they've created islands of, purity in that sense that nothing else comes outside. We don't go out and we don't let others come out. I think that awareness has helped a lot. Now, I mean, the problem really had been the people who are caught in those who are migrant labor, either people who had come from the other districts or from the other states who come to work in Andhra Pradesh, and particularly coastal Andhra and particularly now chilies had come to for harvesting. The fruits have come to harvesting, like papaya, like banana, tomato. And chilies we are the largest chili producers, and more importantly, aqua production. And we produce 40% of both fish and the prawns that are produced in this country. We export them. So these have a short shelf life and they have to be harvested. So these are really big challenges that we had to face. And then, as you can imagine, so many people in the unorganized sector, and Andhra is one of the 6 states in the country where more than 50% of the workforce is in the unorganized sector. So when you have a large number of people who work in the unorganized sector, who virtually survive on a day-to-day basis, it's a huge challenge for them to make both ends meet and, to feed the family. So, I mean, I must say our chief minister has been extremely sensitive to the human angle. I mean, in the sense, his contention has always been the people first and everything else comes later. And in fact, so this balance between the lives and the livelihoods, he sort of weighs on the favor of livelihoods. That's why immediately he sanctioned, we have about 1.4 crore people, households in the state. He had given a 1,000 cash grant to all those holding a white ration card, which is a cash grant, 3 crore households. And in addition, everyone was given 5 kilos of rice on 29th of March with 1 kilo of dal. And that again was repeated on 16th of this month and then again on 29th. So every 15 days, the dal, the rice and oil, so that people at least have the essential ingredients. And the urban areas, we had set up a home supply of vegetables and essential commodities, decentralized markets for people to be available. And more important for the migrant labor, if they are already in the villages where there is employment, the NREGS works or harvesting, they had been part of that. And in the urban areas, they were all sheltered and provided food. So that again created them a certain sanctuary in Andhra Pradesh.
What is the exit strategy we are looking from the long-term situation? Like MHA has given a notification on 20th April, and there is another notification yesterday regarding opening of shops. So people are trying to see this. Different states are saying that we have to also save livelihoods, and if we don't, the damage may be higher. So how is the state looking at this complexity of the situation?
This is certainly a complex situation. We had organized the stay, we have mapped out the physical location of the entire state. I mean, to identify where exactly these positive reports had come in. I mean, we have more than 1,000 cases now, and because we are testing vigorously on a large scale and quite extensively, so more positive cases are surfacing. So we have mapped out all of them and then classified them as red zones. We have mandals, we have 670 mandals, we have 13 districts. We are a 5.4 crore population divided among 13 districts. Some districts are big, have as many as 60 lakh people per district. There are 672 mandals, of which about 41 or so, and mostly these are urban, very urban mandals. There are few rural mandals which are declared as red zones, then orange zones, and then there is of course green zones. So the green zones is where we are opening up. We have started to open up, and we are following those, but with a limited movement, and with the local organized labor. And we have opened up the agriculture, because that had been actually even earlier to some extent, localized agriculture, localized movement of the agriculture commodities. So those had already been started about 10 days ago. And incrementally, we are now opening up the industries where people can come, but practice the physical distancing parameters, the protocols, the sanitation, the hygiene, and there is no movement, then there is no mixing with the people. So with all the precautions, this has to be an incremental process, and it has to be a calibrated, gradually well-planned, well-thought-through system. I do not believe, I mean, I'm not speaking here as a civil servant, but as somebody who spent a long time in public health management. And I do believe that this is a serious matter. This is not going to end tomorrow, notwithstanding some predictions that in 15 days time we'll all be fine and having parties. So I don't see that happening very soon. I think it's quite a while. We need to be prepared for a new normal, a repurposing of our own lives and lifestyles. So in that context, there would be ups and downs. There would be, lift the lockdown, there would be more cases. Maybe we need to really, this is really a management. What is the critical threshold beyond which our hospitals would not be able to manage, or our doctors and nurses would not be able to manage, is the key issue here. It is not that, the whole thing can disappear, because given the nature of the infection, I think it will be a long haul. There will be people who will be getting infected. Many of them will have no problems at all. 80 to 90% of them will be normal, recover back with little symptoms. Then there would be some people who require hospitalization. And this is well known that those with other chronic diseases, those smokers and obese people and hypertension, blood pressure, cancers, I mean, these are all high risk people. They must certainly take care of themselves. I still would like to believe that people below 10 years of age and people above 55 years of age and anyone with any of the chronic diseases should continue to lock himself or herself in. Notwithstanding what people like me may say or government may say, unless you are really compelled, in which case you really need to be an island yourself. You don't mix with people, you minimize your contact, maintain a distance, wear a mask if possible, and maintain the mask hygiene parameters. So this is going to be important for all of us to know exactly how far we are contributing to ourselves, our own health well-being, and also to the others' well-being. So this government can only do 10%, I would like to believe. And then 90% really has to come from citizens working individually and working together. And then there is a private sector, the large driver of the economy, which needs. So all this together is a long haul. And from Andhra Pradesh state's perspective, if I have to limit my conversation to Andhra Pradesh, we are fairly well poised to deal with any such situation.
Fantastic. We are all seeing that this coronavirus has created havoc in US, Europe, many other parts of the world, and it has huge economic impacts. And when the global shocks happen, the India also suffers, and Indian economy also is getting impacted due to the corona and the lockdown situation. The whole economy is on a standstill. Now, how you are seeing what happens in the economic situation, livelihoods, SMEs, MSMEs, and whole economic ecosystem?
I mean, this is a very pertinent question, and I'm sure the policymakers, the economists, the financial professionals, and the market leaders are debating on this issue. And I don't want to add to the confusion that exists already, but I can highlight some of the key elements which I believe are important. First and foremost is that this is a global pandemic in terms of the disease. And so its economic impact is global. And from the IMF projections, the World Bank estimates, and whoever is saying that there will be a serious contraction during this financial year in the economy across the world. I mean, in the sense, everywhere, the important economic activities have been shut down. Whether it is services, whether it is industry, the supply chains are disrupted completely. They're at standstill, barring few essential commodities. So this is a serious situation, and I don't think we have been confronted with a similar situation in the past. I mean, though world wars come closer, but the world wars really impacted those who are in the war zone. Now the entire world is a war zone today. So I think we need to recognize this interconnectedness of the universe, of the humanity, and then everyone is impacted virtually. There's nobody who's immune either from the virus or from the consequences of this virus infection on the economy. So what I would like to believe is that this requires much a global response, and the multilateral system that was set up, whether it is the IMF or World Bank or the United Nations. These were set up in the aftermath of the Second World War and the Great Depression, essentially for reconstruction of those which were war ravaged. Now, when the world is war ravaged, I think there is a need for a new international response. So this is one. I mean, I just want to mention this, put it on the dashboard as an important thing that it requires. And I'm not speaking here as a somebody working in the Andhra Pradesh, but somebody who knows the global context and what happens around the world. So I think this is the time. And everyone across the world needs to think very seriously. Number one, recognize the interconnectedness of the universe. I mean, how the globalization, in a way, has brought in the situation. So the answer is not to retract from globalized universe, but to embrace it with the new tools, new strategies, and new ideas. So that is one set. And coming to our country, I do believe that this is disproportionately would deepen the poverty. This would disproportionately affect the urban poor more than the rural poor. I won't be surprised if the situation continues, if it protracted. We may go back to where we were 20 years ago or 30 years ago. So this is a serious situation. I mean, we need to recognize this for what it is: a large-scale unemployment, poverty, uncertainty of life is simply we cannot afford, and particularly in a country which does not have a solid social safety net. So this is the time, I believe, to look at our institutions, whether it's national institutions or state institutions or decentralized local government institutions, and restructure and reorder them, and really focus on rebuilding the public health system. This is a huge challenge. I mean, we really a miracle that the country is able to. I mean, we still have to see. We have not seen the worst, and I hope the worst would not happen the way that it is happening in the West. But if that were to happen, I don't think we have the wherewithal to really manage the situation. And I mean, notwithstanding the fact we are doing our best. I mean, even in Andhra Pradesh, we are doing our best, but then there are challenges of human resources, trained doctors, trained nurses. So all this is, so we really need to build the public health system. This is a huge opportunity. We need to, in my view, we need to stop this debate whether private sector does, government sector does, insurance models. We need to go for, now, today it's only the government that is managing the pandemic. So we need to really close this debate in once and for all, that there would be a space for the private sector, but there has to be a leader manager role for the government. They need to really take control and then plan for a new paradigm for India on the health system. Safety net, social safety net, particularly for the vulnerable sections. Third is we need to address the urban urban growth. I mean, the way that the urban areas have grown, I think we are seeing much of the case load coming from the urban slums. And how did we let this happen? And why? So, I mean, if I'm already poor, if I'm already deceased, if I'm already living in morbid conditions, and if I already, and again I contract COVID, I lose my job, I lose my wages, and then I won't be able to return to employment for a long time. So these are important issues. And of course, this goes beyond, of course, MSMEs and the industry, the financial sector, which will be majorly impacted. So this is where I believe the central government and the Reserve Bank of India need to come together, have a coherent strategy, because the states are badly impacted and the states do not have the fiscal space to indulge in further borrowings. There is no resources that they can raise at this moment given this situation. So there's also a time to look at the expenditure management by the states and the central government, and trim all the unavoidable expenditure, look at those subsidies which are non-merit subsidies. So as a man who's managed finances for a long time, I feel very concerned about what the future looks like. But and I'm sure we have managed many crises in the country, and I'm sure we'll get through with this. But the challenge is how well we will emerge through this challenge, rather than whether we are bruised with broken bones. There's no point moving forwards. So the smoothening of this, the poverty is, I suppose, is the most important challenge.
Sure. Since you have worked in both India and abroad and international multilateral organizations, and you have been on that basis, you have a broader global understanding of the situation and the global combined effort it is needed, which you have highlighted. You also have worked as a finance secretary in the Andhra Pradesh government. And as you mentioned that a lot of expenditure management issues have to be addressed. The last time perhaps India had a severe crisis of this scale was perhaps 1991 crisis. And that crisis forced India to do major reforms, which are still remembered. Do you think that this crisis is asking us to look at major economic reforms, financial reforms, labor reforms, which have been long pending, to attract FDI? Like people are like, just yesterday I was reading a news that while everyone is like thinking that the Chinese, those companies who are invested in China will come to India after Corona, but many are actually going to Vietnam and a few other states instead of coming to India, because they're finding uh, easier to open the companies there. Tax systems are much simple, perhaps more conducive. Labor reforms are there. So, are you seeing a similar now the situation in like 91, where it may lead us to some big reforms now?
No, I think, I don't think we can compare this with the 91 crisis. I think our macroeconomic management has been on a solid footing
Yes,
for a
yes,
quite long time. And I think
yes,
in our financial sector, though there is certain fragility as far as the banks and the non-banking finance companies are concerned, but the overall monetary system is quite robust. I mean, look at $470 billion of foreign reserves. I mean, this is really a huge asset. And also, the balance sheet of Reserve Bank of India with more maybe 8-9 lakh crores. These are solid foundations as far on the monetary front. There are challenges on the fiscal front, and particularly the ballooning of the fiscal deficit, the particularly states and center combined, off-budget borrowings, the avoidable revenue expenditure. So these are so we are in a very different context from 1991. Now today we are really faced with a situation in which there is a disproportionate impact on the government system, on the public financing. Second is there is also a supply side contraction and a demand side contraction. So this is a very unusual situation in which you have a sort of a global contraction on both the demand and the supply. And so this requires for completely, in my view, I don't want to sound cliched, but it certainly needs an out of the room sort of a thinking, not more than the box. I think we need to get out of the room, get people together, think through this seriously. And unless I think everyone, the policymakers, the intellectuals, the public intellectuals, take this seriously, that this is not an ordinary situation, because everybody seems to think this is something, okay, we have gone through the lockdown for 45 days, we have had enough, let's go out and party and, we will all be fine. No, we will not be fine. I don't think as a doctor and as somebody who understands these things, I don't think we'll be fine. It'll be a long while before we'll be fine. We have to change our lifestyles. We have to change the way we relate with the others in the society. We need to change the way we work. We need to change the way we think. I think a lot of things, we need to be disciplined. We need to be more hygiene conscious, more health conscious. So I think if we have to change our lifestyles. I mean, we see actually those people who are now dying of corona infection are all those, many of them have lifestyle problems. Not so this. I mean, if I smoke, and that is a lifestyle problem. And if I don't exercise and I get diabetes out of that, it is a lifestyle issue. So these are things that we need to think through seriously at individual level. At an institutional level, both the private sector and the, because I mean this is, nobody has imposed this burden on either the government or the private. This is a unique situation in which the government cannot even come to the rescue of the private sector, though it can create instruments and the mechanisms through which there could be support for the private sector, particularly for the MSMEs. But the fact remains that everyone is impacted equally. I mean, ultimately the government doesn't have its own money. It's the taxpayer who finances the government expenditure. So I think in this sort of a global strain, this requires completely a very clear thinking, a very clear roadmap, in my view.
So, as we all know that the government's finances are already constrained, we are in financial deficit anyway. But if you look at US, Canada, and many other countries, countries have gone for supporting the SMEs and MSMEs by bailout packages, by taking care of the employee salaries and stuff like that, and waiver of rentals, waiver of interest, many things like that. The problem in India is that maybe we don't have that much of fiscal space itself in the center. Now, as you have mentioned that RBI is like sitting on the huge reserves of the foreign exchange. So is that the solution left for supporting the economy and like saving it?
I think, I mean, it's an important question because, I mean, this is a double-edged weapon because ultimately the foreign investors also look at your books and, your fiscal stability, the long-term sustainability of your finances and the public finances. Now, if unless we inspire confidence in terms that there is a macroeconomic stability, by both the monetary policies and the fiscal policies, it doesn't inspire the confidence. I mean, we are now seeing, though RBI has cut the repo rate, the bond yields have actually gone up. And I'm talking about the government treasury bonds. So, I mean, it also shows a certain insecurity and lack of confidence in investing in the government securities. So we need to really, I think there is an issue to be addressed seriously on this front. It is difficult, and particularly people would demand, I mean, how do I create a social safety net? Particularly when there are so many people who are vulnerable. How do I manage this COVID crisis? So, I mean, it is an issue. You need money to do this business. So, this is between Government of India and the Reserve Bank of India with the state governments. And I personally, this is my personal view, is that either Finance Commission, which is already in existence and which has already done a review of the state finances, federal finances, maybe really its terms of reference must be reworked, given a constitutional mandate to really review this entire situation afresh and come up with a suggestion in which the states must be represented, center must be represented, RBI must be represented. So I'm proposing an expanded Reserve Bank, expanded Finance Commission, or a new institution altogether, autonomous and constitutionally protected, so it can give a more professional, independent advice. And this should advise both the states and the center. There is a need for a fresh review of government expenditure, where we really need to put our resources and which are priorities. And we cannot afford, because, I mean, where is the fiscal space for borrowing? I mean, even if the FRBM is relaxed to 5% or 7% or much higher, I mean, the US has given a stimulus package of $2.2 trillion. I mean, yes. 10% of its GDP.
Yes.
Now, the UK with it's almost a nearly $1 trillion pounds, I mean, $750 billion. Now, they do have the space to manage that, but there is a case for looking at this more closely. I mean, without breaking our financial system, without causing serious inflation. And the banks also need to look at their own balance sheets more carefully and see maybe there is a case for a moratorium uh, on all debt servicing of the private public sector for a year. That there may be a case. There may be a case for further capitalization of the banks, financial institutions. And now RBI has taken a number of measures, which I hopefully will be able to smoothen this crisis, this difficulties, and particularly NBFCs. If the NBFCs can be roped in, and particularly I ran one of the largest NBFCs, the REC, and those agencies' mandate can be expanded. Today they only lend to the power sector. Why not all other infrastructure instruments? Because they can create instruments for the long term. Because you need to invest, also continue to push the economy by creating employment. And so I don't think that the NREGS type of works are in the terms of long-term sustainability. Now you really need to move them on to these more sustainable investments. This requires a lot more thinking and discussion, in my view.
What is the situation like you are sitting in Andhra Pradesh? What is the situation of SMEs, MSMEs there? Have they given representation to you? And
no, I think
what
are yeah. Go ahead, Doug.
What are the challenges like they are talking about their future? What is the situation there?
You see, I mean, it's the same situation across the country, I suppose. I mean, it's the MSMEs that are worst impacted, and they will be forced to lay off the workforce, cut down on their scale of operations, and then they are faced with the challenges of working capital. So these things need to be addressed very seriously. I mean, particularly if they have to service the debt, that is another challenge. I mean, then how do you pay salaries to your employees? So there are real issues. And then it would not be possible also for any industry to run full scale. I mean, come another 15 days, maybe we may have to reimpose lockdowns in certain areas. We may have to expand the lockdowns. We don't know. The green zones can become red zones. So this is a dynamic process. We need to consider them and look at them in real time, and then be innovative. I'm seeing that what was relevant yesterday and what we felt was true and true facts are no more relevant today. I mean, this is true of the virus, the way virus is conducting itself, and it is also true of its impact on the economy.
So there are some questions here which people have asked. Some are related to the disease. Like if you can open your screen and have a look at it, and I can also.
Oh yeah.
So if you, because some of the issues we have already discussed and covered here, but if you want to respond on some of them, you can have a look at it.
Yeah. Now let me very quickly say that as far as technology is concerned, of course we are using technology extensively in terms of tracking people, tracking those people who needed to be tracked. So in that sense, we are and then reporting real-time information collection. So there is a lot of technology application. Could we do more? Yes, I am sure we could do more, and because this is the time when different states are using different technologies, and then today I see reports that there are certain security issues involved in that. So maybe we need to look at it closely. We need to collaborate much more, because each one of us are busy with, in an emergency of this nature, and this is an unprecedented emergency. I mean, this is not something like floods or cyclones which we have managed. It's few days to work, few people are involved, and it's gone. It's not the case. Everyone is affected. Everyone is impacted. And, each one of us are vulnerable again as individuals, as human beings. So this is, so it requires everyone to come together. And if anybody has a technological options which are superior, we'll certainly look at them. Then with regard to PDS, I must say that is something which my Chief Minister placed the highest importance of, the public distribution system, delivery of essential services, delivery of essential commodities. I mean, those are high priority for us, and we are working. We are supplying, as I said, the PDS has been activated. It is functioning. It has functioned throughout the lockdown, and it keeps going. And then, with reference to, I've already talked about the governance structure, and I also see I've called, and I would like to believe that we could spend a lot of time on talking about what type of institutions that would be required in the, particularly if this crisis is going to be protracted, it's going to last long. Then of course we need to think of what type of institutions, what type of to create. And because this may not be one-off situation, this may be a new beginning of a new type of a challenge that the mankind faces. So we need to really think through, because this is one time when the entire humanity should be united, because we all have the same threat, and it doesn't distinguish the borders, the nation states, the rich and the poor, the old and the young, and all that religion, caste. It doesn't really make a difference. So I think we need to really come alive to such things. And I've already talked about the Andhra Pradesh spike from Delhi and the foreign returnees. And that stage, I think, is past. I want to especially advise my colleagues from Andhra Pradesh and also maybe from other states, if those who are listening to this session, that I think the foreign returnees and their contacts, or the Delhi returnees and their contacts, I think broadly that is dying down. Now, what we really have is much larger presence in the society. It's inevitable. I mean, in the sense that we harbor these viruses without symptoms. Now, we are talking to each other. We don't know because we have no symptoms. We are fine people, and we would like to believe that we are free of virus, but maybe we have them. So, this is the problem. Actually, what I'm seeing now is that 80% of the people who are tested positive have no symptoms at all. That's why people are wondering what the hell is going on. I'm fine, and the people are keeping me in lockdown, or in quarantine, or they have mild symptoms. I'm just not feeling all that fine, energetic, little less energy. But but these are the people who are spreading infection. So we need to be alive to that particular reality. Then, with regard to the issue which you raised earlier, which I had not addressed clearly, and somebody is asking for that, is about the investment. I mean, Andhra is a state which has all the ingredients that are ideal for international and national investments in industry, in services, in logistics, because we have a long coastline. It's a 1,000-kilometer long coastline. And it's a coastline that faces the east. And east is where the economic boom is, whether China, Japan, Korea. I mean, these are the areas, and Southeast Asia, which again would bounce back very fast. So and then we already have a huge infrastructure. And then we are investing $1 billion as part of these industrial corridor projects, Vizag, Chennai, and Chennai, Bangalore projects. So these are areas where there's a huge opportunity, and we already have a number of clusters, whether it's pharma cluster, whether it is the Sri City, where you have the electronic cluster, the ports, the major ports, the Krishnapatnam, and the industrial ecosystem that is developed around that. The 4 industrial cities that are planned, where international, national investors can come and invest and really grow with us. It's East Coast has not had a fintech hub. Vizag would be an ideal location for fintech, and that would continue to be. Actually, I think people would use the technology more and more for financial transactions, both at an individual level and at a collective level. So I think we have a big opportunity there. And then somebody has also asked about the insurance Yeah, I mean, I think the government, I think there's a concern about the government functionaries being taken care of. And my chief minister is very, very sensitive to these. He's announced a whole slew of incentives for the staff. But at the same time, the government employees, I mean, are doing a tremendous job. In fact, there's nobody. I mean, this is an incredible amount at their personal risk that the people are working. But also we need to recognize that the government revenues are seriously stressed. I mean, the liquor is closed. There's no
Yes,
land transactions that are taking place.
yes,
The petrol consumption is down to 10 to 15%. Now, where do we get? And all the commercial activities are shut. So, I mean, I'm just trying to put this in a perspective. So,
exactly.
obviously, it's a huge challenge in a way to even pay the salaries of the employees. So, we are trying to do our best in a very difficult circumstance. So, we will certainly be alive to this needs and pensioners. Chief Minister again decided that all pensioners must be paid full pension. So I think all these are positive signs. He's very committed to ensuring everybody is taken care. Every citizen is taken care. He feels that he is like a father who has to really care for everyone. And I think that is a great sentiment for any leader and any executive head of a state. So these are some of the questions I thought I could
Yeah,
answer.
perfect. Perfect, sir. I think we have had a great conversation, great uh, range of issues we have discussed, and with your great range of experience, uh, this has been possible. Uh, I would like to thank you for this fantastic conversation, and I think that it would have helped the audience to understand the issue in a much larger perspective, global perspective. In fact, I will say that I had not thought about various global issues unless this discussion has happened. So I will request all the audience, if you have liked this conversation, please share it on your Facebook, like this is live on the Facebook. And Dr. Ramesh, you have attended our several conferences last 15 years, both in Hyderabad and other places. And you have seen our magazines, you have given interviews there, and we are doing this webinar today. So we at Elets have been on the mission to propagate innovations which the government is doing, and bridge that gap between the government and the citizen. And your inputs and suggestions on our work, if you can give us, that would be very nice.
Thank you. I mean, thank you. I want to congratulate you, Dr. Gupta, and your colleagues who have made this possible, and all those who attended. I think it's a great platform in which you really bring together the citizens, the businesses, and the government in one platform and facilitate, the communication between them. A very interesting conversation, and this. In a time when we are all under lockdown, though some of us are called up to work more than we normally do, but overall, when we are locked up, this is perhaps is the best way of communicating. And I've attended your events, which are very valuable and informative. It's benefited everyone concerned, and also it helped in networking people and many of the issues. And thank you for asking me these questions, which are very, very incisive, very insightful, and very important. And I hope I've been able to share my views candidly. I think it's very important that we all recognize that come 3rd of May, that the India as our own life, as we had known it, will continue to be what it was prior to 20th of March. And I think that's first point message I want to give. We have to be responsible. I particularly call upon the youngsters and the youth, and of course the elderly, everyone, to be extremely responsible for oneself. The virus will continue to be around. It will continue to be look for us, and we need to take care of ourselves, and we need to take care of our families, our loved ones, our friends, our neighbors, and the entire society. So please take that responsibility. And all we need to do is to keep yourself, maintain physical distance, don't touch your face, wash your hands as frequently as possible, wear a mask, and don't touch the mask. And that is more dangerous than anything else, you know. When you wear a mask, that is more demanding actually, that is than not wearing one. And so and then of course maintain your health, maintain good health, change your bad habits if there are any. And all this together, we hope, and we governments will certainly do their best, but the citizens of all of us together join hands. And then I call upon the private sector, financial institutions, state, central governments to really come together in this time and take a fresh look. This is an opportunity. This is a transformational opportunity. This is a millennial opportunity in my view, not just a centuries opportunity. I think we should make full use of this in such a way that we can really not just reform, but reorder, restructure, repurpose, and realign both our institutions and their priorities. Thank you so much, and thank you. Grateful.
Thank you, Ramesh. Thank you, all the audience. With this, we will end this. And namaskar to you, Dr. Ramesh. Namaskar.